Fairfax is a continuing care retirement community that was developed in the 80s for retired military officers and their spouses. We have a large independent living population. We have skilled nursing, assisted living, and memory support. And we've been aware for a long time the need to reduce the use of antipsychotic medications in our resident population. And over the past few years, we've been able to do that by 56%.
Every patient who comes to us from outside who's on any psychotropic gets a psychiatric evaluation. We immediately try to reduce them after observing the patient for a period of time.
When we look at people coming in for admission and they might have been put on something in the hospital that they didn't really need, so we talk with Jerry Psych and we do the gradual dose reductions.
Typically, the nursing will notify therapy whether or not medication is either going to be increased, decreased, or even introduced as an option to something that's going on with the patient. Then as therapists, we will then enter that patient's plan of care to see if there's anything we can do on our end to see if we can help the patient have a better daily routine.
Activities can provide things that are equally as effective in calming or soothing a person, in comforting a person, in redirecting their anxiety, their worries, allowing them to separate themselves from any fearfulness or obsessive tendencies that they may have. So once you've established a good relationship with your resident, they trust you, they love you, they know that you love and you're caring for them, that opens the doors to utilizing a variety of certain methods. Music therapy, art therapy, physical activity and exercise is often extremely beneficial depending upon someone's abilities.
It's more important for us to determine what's causing the behavior, find out what is triggering the behavior, what are some non-pharmacological things that we can do to affect the behavior, rather than the first step being a pharmacological intervention. One of the things we try to do is surround ourselves with really good professionals, and we like to present a forum where all of that great input can come together in the appropriate melting pot, which then generates a successful outcome for a guest.
Social interaction is often magic. People awaken when there is social interaction. People's behavior improves when there's social interaction.
We really emphasize the importance of training our team members. So we join our residents with dementia on their journey, and it's amazing to see how that behavioral expression will ease with time when they have a trusted listener and someone who's trained to ask the right questions.
Being able to give someone the best and quality amount of care and consideration that you can is critical and extremely rewarding.
It's very important to us to create the best environment for them. It's what they deserve, and we can do no less. I love being surrounded by professionals that are all geared toward the same thing, which is the absolute best care of our guests.
Interacting with patients is just rewarding all in itself. They have wonderful stories. They enjoy seeing you every day. You're changing their life, ultimately. It's just really rewarding for us to have that daily interaction.